Hi, hello friends, very good morning to one and all. Welcome to our channel, The Voice of Nurse. Today we are going to start a new beginning related to the nursing subjects about model paper related to the staff nurse 2023 exam purpose. We are going to discuss a model papers. In Telangana state, recently we got a exam date announced by Telangana state MHSRB. August 2nd, we are having the TS MHSRB exam. Mainly my focus on only TS MHSRB now. So today we are going to discuss, today onwards we are going to discuss model paper for staff nurse 2023. Staff nurse previous year model papers with explanation. I will conduct a classes, I will make a videos, and also especially I will mention one more thing also. Recently we completed sociology subject. Till sociology subject successfully we finished 90% of all subjects we already covered. Today onwards we are going to discuss model papers related to the TSMHSRB staff nurse, and also these model paper related to the staff nurse 2023 model papers we can prepare for all competitive exams related to the staff nurse. We can prepare for all exams related to the staff nurse. Previously we already discussed one set of model paper, previous year's model paper related to the MHSRB staff nurse. About this model paper I give a link in description. Just check it once friends. Anybody newly watching my channel, please check it once, and also please look it on all subjects related to the staff nurse FAQs and very important questions. In model paper first set we completed 3 parts related to the model paper previous years and FAQs also. We are having 3 parts in set 1 model paper. Today we are going to discuss set 2 related to the model paper. Means we already finished 100 question in set 1. Now today we are going to discuss second model paper related to the staff nurse exam 2023. Focus on 2023 exam MHSRB and also all competitive exam purpose model paper. Before moving on to topic, a small request friends, anybody here newly watching my channel, please subscribe my channel, click on the bell icon for further notification. While watching the video, please give a like if content is useful. So please give a like and share the video to your friends. Click on the bell icon for further notification. Let's move on to topic model paper for staff nurse 2023. Question number 1. As soon as the patient enters the PACU, priority assessment by the nurse is. As soon as the patient enters the PACU. PACU means post anesthesia care unit. So here as soon as the patient enters into the post anesthesia care unit, the priority assessment by the nurse. We will see here options. Option A, ECG monitoring. Option B, urinary output. Option C, level of consciousness. Option D, airway patency and respiratory status. What is the post anesthesia care unit by nurse? What is the priority? We will see now. The immediate post anesthesia care unit, the nursing care focuses on maintaining ventilation and circulation, monitoring oxygenation and level of consciousness, preventing shock and managing pain. The nurse should assess and document respiratory status and circulatory and neurological functions frequently, maintain fluid balance, providing wound care, monitoring bowel function, assisting with mobility and preventing complications. The first priority is respiratory adequacy. So here as soon as the patient enters the post anesthesia care unit, priority assessment by the nurse is airway patency and respiratory status. So here the nurse should assess respiratory adequacy, monitoring oxygenation, ventilation, circulation, and level of consciousness and temperature. These all are the responsibilities of post anesthesia care unit. The priority assessment by the nurse is airway patency and respiratory status. This is the first priority of a nurse. We can monitor urinary output also, level of consciousness, and also oxygen levels, ventilation. We have to document related to the respiratory, circulatory, and neurological functions related to the client. So here option D, airway patency and respiratory status is the correct answer here. Next we will move on to question number 2. How many pairs of spinal nerves? How many pairs of spinal nerves? We will see here options. Option A 34 pairs, option B 31 pairs, option C 30 pairs, option D 8 pairs. There are 31 pairs of spinal nerves in humans. Those are 8 cervical nerves, 12 thoracic nerves, 5 lumbar nerves, 5 sacral, and 1 coccygeal. In total, there are 31 pairs of spinal nerves grouped regionally by spinal region. So, there are 31 spinal nerves originate in between the spinal vertebrae. Largest nerve in body, sciatic nerve. Smallest nerve in body is trochlear nerve. Here in this question, how many pairs of spinal nerve is there? But in exam, we will get like this. What is the largest nerve in body? Answer is sciatic nerve. What is the smallest nerve in human body? Answer is trochlear nerve. Like this also we will get a question in exam. That's why I am mentioning what is the biggest nerve and smallest nerve also. So coming to question, how many pairs of spinal nerves means here 31 pairs of spinal nerves you are having. So here option B is the correct answer. 8 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 1 coccygeal. Totally 31 pairs of spinal nerves. So here option B is the correct answer. Next we will move on to question number 3. String sign is seen in. We can see string sign in which condition? We will see here options. Option A hernia, option B ulcerative colitis, option C Crohn's disease, option D all of the above. What is string sign? We have to know first. String sign is a term often applied to the appearance of any marked narrowing of lumen, but it originated as a descriptor of reversible narrowing in Crohn's disease. So here we got a answer also. String sign is term often applied to the appearance of any marked narrowing of the lumen. The gastrointestinal string sign has been identified as a manifestation of Crohn's disease, and it is observed most frequently in the terminal ileum. The iliac abnormalities associated with early Crohn's disease includes a coarse bilious pattern, fold thickening, and ophthalmos ulcers. String sign is refers to luminal narrowing as the result of inflammatory edema, irritability, spasms, and fibrosis classically associated with in Crohn's disease. So here string sign is seen in Crohn's disease. So here in these options, option C is the correct answer. GI string sign has been identified as a manifestation of Crohn's disease and observed most frequently in terminal ileum. So here string sign is seen in Crohn's disease. Option C is the correct answer here. Next we will move on to question number 4. In mental process, which gives meaning to the sensation? In mental process, which will give a meaning to the sensation? We will see here options. Option A compensation, option B identification, option C perception, option D rationalization. Sensation is an input about the physical world obtaining by our sensory receptors, and perception is the process by which the brain selects, organizes, and interprets the sensation. What is the meaning of sensation? The meaning to the sensation on the basis of past experience is called as perception. In psychology, sensation is a conscious or mental process generated by stimulating a sense organ, sensory nerve, or sensory region in the brain. In mental process which gives meaning to the sensation means perception is the perfect term. Sensation is an input about the physical world obtaining by our sensory receptors. Here in mental process which gives meaning to the sensation means here option C, perception is the correct answer. Next we will move on to question number 5. Location of pain in appendicitis. Which location we can feel the appendicitis pain? Here we will see options. Option A, Murphy sign. Option B, Erb's point. Option C, MC Burney's point. Option D, none of the above. A typical day starts with a pain in the middle of the tummy that may come and go within hours. The pain travels to the lower right hand side, exactly where the appendix is usually located, and becomes constant and severe. To test MC Burney's point, the individual should be lying on their back on an examination table. A clinician will apply slow pressure over MC Burney's point and then quickly release that hand. The presence of severe pain when pressure is released in indicative of positive test means appendicitis and raises the suspicion for acute appendicitis. So here the location of pain in appendicitis is option C, MC Burney's point is the correct answer here. Next we will move on to question number 6. Which of the following statement is true? Here in this option, true statement is there related to the culture. Actually here related to the culture only we are having question. Which of the following statement is true? We will see here options. Option A, culture denotes the material achievements of people. Option B, culture is the accumulation of artificial objects. Option C, A and B. Option D, culture denotes acquired behavior. We have to know what is culture also in this question. We will see in detail about culture. Culture of which we are a part impacts our identity and even our beliefs about the culture of life. Culture either individualistic or collective into which a person is born affect and influences what that person believes, how that person behaves in society. It is a culture. The word culture is used to denote acquired behaviors, beliefs, feelings and thoughts. So here which of the following statement is true means here option D is the correct statement related to the culture. Culture will denote acquired behavior. Actually the word culture is used to denote acquired behaviors, beliefs, feelings and thoughts. So here option C is the correct answer. Culture denotes acquired behavior. Next we will move on to question number 7. Calculate the EDD for a mother whose LMP is 4,922. Here calculate EDD for mother who is having LMP means here expected date of delivery for a mother. LMP was last menstrual period was 4th 9th 2022. We will see here options. First option A 11/6/2023, option B 11/7/2023, option C 11/5/2023, option D 11/8/2023. For calculating the EDD we are having three main steps. The first step is first day of last menstrual period date and second step is 3 calendar months from that date. The third step was add 7 days to the date. Here EDD by LMP is calculated by adding 280 days to the first day of the last menstrual period. You can also subtract 3 months from first day of last period and add 7 days pregnancy normally. Last from 37 weeks to 42 weeks from the first day of last period. So here the LMP was 4/9/2022 means here we have to calculate like for date 4th means we have to add a 7 days here for date of 4th. Next month means we have to add 280 days means 3 calendary months. So here year will change automatically. So here in this option 2022 year means 2023 we will get. Here we have to add a date for 4th month 7 days means we will get a 11th date. Here month was 9th. So you have to add a 280 days. Here correctly we will get option C 11/5/2023. Your answer also option C is the correct. Anybody is having related to the calculation of EDD, just give a comment in comment section. I will give a clear clarification related to the topic. Next move on to question number 8. Patient with gout disease, the nurse should give a health education about. Here the client is having a gout disease. The nurse should give a health education about. We will see here option. Option A, avoid high fatty foods. Option B, drink plenty of fluids. Option C, apply ice. Option D, all of the above. What is gout disease? We have to know. Gout disease is also called as gouty arthritis. Gout disease is a form of arthritis characterized by severe pain, redness and tenderness in the joints. Pain and inflammation occur when too much uric acid crystallizes and deposits in the joints. The nurse have to give health education about eat more fruits, vegetables and whole grains, which are provides complex carbohydrates, and limit consumption of naturally sweet fruit juices. Maintaining in balanced diet, low in uric acid, keep uric acid levels below 6 grams per dl helps to reduce chance of having a gout attacks, and also especially liquids related to the liquids. Advise drink plenty of fluids in regular intervals. So here the patient with gout disease, the nurse should give a health education about drink plenty of fluids. So here option B is the correct answer here. Next we will move on to question number 9. In human body, HB stored in which form of following? Here human body, HB means hemoglobin only. In human body, hemoglobin will stored in which form of following options? We will see here option. Option A, heme. Option B, ferritin. Option C, transferring. Option D, all of the above. HB stored form of iron contained in the heme portion of hemoglobin may be stored in the liver or spleen, primarily in the form of ferritin, or carried through the bloodstream by transferring to the red bone marrow for recycling into new erythrocytes. About 70% of body's iron found in the red blood cells of blood called as hemoglobin. In human body, hemoglobin is stored in form of heme, ferritin, transferring. So here in these options, option D, all of the above is the correct answer. In human body, HB will stored in heme, ferritin, transferring. Like HB stored in form of iron contained in the form of heme portion of hemoglobin, and may be stored in liver or spleen, primarily form of ferritin. It is carried out through the bloodstream by transferring. So here all of the above is the correct answer. I think all of you clear. Next we will move on to question number 10. After suctioning of tracheostomy, the nurse evaluates the effectiveness of procedure by monitoring. Here the client is having on tracheostomy support. After suctioning of tracheostomy, the nurse evaluates effectiveness of procedure by monitoring of what? We will see here options. Option A, blood pressure. Option B, breath sounds. Option C, pulse rate. Option D, temperature. Evaluate the effectiveness of the procedure and patient's respiratory status. Assess the patient's respiratory rate, skin color and or oximetry reading to ensure the patient has not been compromised during this procedure. During and after suctioning, the nurse should monitor the patient for common complications such as bradycardia and also hypoxia and or hypoxia. If patient is undergone hypoxia means automatically bradycardia will happen. So the complication before and after the procedure, the nurse should monitor bradycardia, hypoxia, vital signs before and after the procedure. Must and foremost we have to check breath sounds. So here after suctioning of tracheostomy, the nurse have to evaluate effectiveness of procedure by monitoring of breath sounds. So here option B is the correct answer. Next we will move on to question number 11. If patient develops blood transfusion reaction, the nurse's immediate responsibility. Here the patient is developing blood transfusion reactions. What is the responsibility of nurse? Immediately what she have to do? We will see here options. Option A, administer antihistamines. Option B, stop the transfusion immediately. Option C, inform to physician. Option D, continue the transfusion. Not only blood transfusion, any client anytime develops any transfusion reactions means IV fluid or any injection or any infusion reactions related to the any rashes, lethargy, headache, vomiting, nausea means we have to stop immediately. So here option B is the correct answer. Here the nurse responsibility, immediate responsibility of nurse, stop transfusion immediately. Place the client in flowers position if patient is complaining of shortness of breath, and administer oxygen therapy also. The nurse remains with the client observing signs and symptoms and monitoring the vital signs as often as every 15 minutes. Nurse should document any abnormal findings and transfusion reactions in the nursing care plan, and also after stopping transfusion immediately, the nurse should have to inform physician. As a nurse, we have to check before blood transfusion, blood group, vital signs, consent related to the blood transfusion, health history, data collection related to the any allergies, and data expiry related to the blood bag cross matching. Consent related to the transfusion means we have to give a detailed explanation to the client and attenders, and also blood bag, date of expiry and date of collection. Depending upon the type of blood bag used, the shelf life range from the 35 to 42 days at the range of 6 degrees Celsius in temperature. So here the nurse have to stop immediately transfusion. So here stop the transfusion immediately. Option B is the correct answer. Next we will move on to question number 12. Signs of increased intracranial pressure. What is the signs of increased ICP? We will see here options. Option A, slow bonding pulse, increased blood pressure, irregular respiration. Option B, slow pulse, decreased blood pressure, low temperature. Option C, rapid weak pulse, decreased blood pressure, low temperature. Option D, weak pulse, normal blood pressure, lethargy. Primary cause of increased intracranial pressure is an injury to the head or skull. Raised intracranial pressure is a common problem in neurosurgical and neurological problem. Changes in blood pressure, pulse and respiration pattern are usually late sign of raised intracranial pressure in clinical practice. Most common symptoms of an intracranial pressure is increased means headache, blurred vision, feeling less altered than usual. Here, the normal ICP intracranial pressure is 5 to 15 mmHg. Here, signs of increased intracranial pressure means option A is the correct answer. Slow bounding pulse, increased blood pressure, irregular respiration. Next, we will move on to question number 13. Rabies is transmitted by the bite of. We will see here option. Option A, Anopheles mosquito. Option B, a rabid animal. Option C, B. Option D, cat. Rabies is transmitted by the bite of rabid animals. People usually get rabies from the bite of a rabid animal. People to get rabies from non-bite exposures, which can include scratches, abrasions, or open wounds that are exposed to saliva or other potentially infectious material from a rabid animal. Once a rabies infection is established, there is no effective treatment for the rabies. Here, rabies is transmitted by the bite of option B, rabid animal. The rabid animal, for example, a rabid dog is transmitted a rabies. So here option B is the correct answer. Rabies is transmitted by the bite of rabid animal. Next we will move on to question number 14. When assessing a patient who has anorexia nervosa, nurse should observe except. Here the patient is having anorexia nervosa. The nurse should observe from the option what we have to accept. We will see here options. Option A, tachycardia. Option B, hypotension. Option C, heat sensitivity. Option D, dysmenorrhea. Here approximately questions all we discussed related to the all subjects related to the MHSRB. Already we completed. Most of questions are repeated in the exams also. Please just study related to the all subjects in all my videos. Please check it once, friends. All repeated questions we got here. This is related to the MHSRB previous year question paper only. Approximately all questions we discussed in related to the subjects. Just check it once, friends. Related to the question number 14 we will discuss now. Here, what is anorexia nervosa? Anorexia nervosa, it is one of the type of eating disorder, also psychotic disease. Here, eating disorders, we are having two types of eating disorders. Those are bulimia nervosa and anorexia nervosa. Here, what is bulimia nervosa? What is anorexia nervosa? We will see now. Here, bulimia nervosa is a serious eating disorder marked by beginning followed by methods of avoid weight gain. This is called as bulimia nervosa. Bulimia nervosa is a life-threatening eating disorder. What is anorexia nervosa? Anorexia nervosa is the psychotic disease in which patients restrict their food intake, eating less, exercising more. Symptoms like extreme weight loss, abnormal blood counts, insomnia, fatigue, dizziness, bluish discoloration of the fingers. So here, when assessing a patient who has anorexia nervosa, the nurse should observe tachycardia, heat sensitivity and dysmenorrhea. These all are the signs and symptoms related to the anorexia nervosa client. So here option B, hypotension, except here. So here option B is the except. Next we will move on to question number 15. Immediate treatment for gas poisoning. What is the immediate treatment for gas poisoning? We will see here options. Option A, move the patient from the area. Option B, loosen the clothes and shift to hospital. Option C, don't give anything orally. Option D, all of the above. Immediate treatment for gas poisoning. The first aid or immediate treatment for the gas poisoning client. Get the person to fresh air. Move the person away from the exact area. Start CPR if necessary, means person or victim is unresponsive, not breathing. Then begin CPR and call 911 or local emergency medical services EMS. In the emergency room, standard treatment involves breathing pure oxygen through the mask placed over the nose and mouth. It helps oxygen to reach organs and tissues. The immediate treatment for the gout poisoning here. All of the above is the correct answer. We have to move the patient from the area, loosen the cloths and shift it to hospital. Do not give or don't give anything orally. So here all of the above is the correct answer. The immediate treatment for the gas poisoning is all of the above here. Next we will move on to question number 16. Shifting of the pleural drainage patient from the bed to wheelchair. What we have to do? Here the client is having pleural drainage. We are shifting the patient from bed to wheelchair. What we have to do here? Options: option A, do not clamp. Option B, clamping the tube. Option C, remove the tube. Option D, none of the above. Clamping as per current clinical practices saves reinsertion of the chest drainage in 11% of cases. Has the potential to save more if clamped for up to 24 hours. Keep moving the clamp down the drainage tubing towards and the chest drainage system, placing it to 20 to 30 centimeter intervals. Through the clamping of tube, we can avoid a pneumothorax also. Decreases in cases of decreases the pneumothorax also. Here shifting the pleural drainage patient from the bed to wheelchair, the nurse should have to clamping the tube. So here option B is the correct answer. Next we will move on to question number 17. While applying the bandage to the head, nurse must be stand at the patient. While applying the bandage to the head, where the nurse should have to stand to the patient. We will see here option A at front, option B back of the patient, option C side of the patient, option D A and B. What is bandage? Bandage is a process by which a wound or injured part is covered and protected with the help of a bandage. While applying bandage, stand at the side which is to be bandaged. Start bandaging from the front and injured side of the casualty. Applying the bandage firmly but not so tight that it's restricting the circulation. So we have to apply bandage firmly and also face the patients while applying the bandage, except applying it on the head. While applying the head, should not stand in the front of the client. Always should back of the patient. While applying the bandage to the head, nurse must have to stand at the patient, means back of the patient. So here option B is the correct answer. Next we will move on to question number 18. Rickets is characterized by which vitamin deficiency? Rickets is characterized by which of the deficiency of vitamin? Which deficiency we will see here? Options: option A calciferol, option B folic acid, option C vitamin C, option D nicotinic acid. The most common cause of rickets is a lack of vitamin D or calcium in a child's diet. Both are essential for children to develop strong and healthy bones and teeth. Deficiency results in impaired bone mineralization and it leads to bone softening diseases, rickets in children and osteomalacia in adults. Calciferol is a vitamin D2. Calciferol is vitamin D drug choice and vitamin D drug classification. Here rickets is characterized by which vitamin deficiency, means here option A calciferol is the correct answer. Calciferol is vitamin D2 and calciferol is vitamin D drug classification. Due to the vitamin D deficiency only we will get a rickets. So here rickets is characterized by calciferol vitamin deficiency. Next we will move on to question number 19. First aid objectives are. What are the first aid objectives from the following? We will see here options. Option A preserve life, option B. Prevent injury, option C. Relieve pain, option D. All of the above. What is first aid? First aid is refers to medical attention that is usually administered immediately after the injury occurs and at the location where it occurred. Essentially, we are having three objectives related to the first aid. Those are three P's are main objectives. Those are preserving life, preventing injury from the getting worse, and protecting the unconscious and relieving pain. So here the first aid objectives comes preserving life, preventing injury from the getting worse, aiding recovery, protecting the unconsciousness, relieving pain. So here option D, all of the above is the correct answer. These all are first aid objectives only. Next we will move on to question number 20. Projection, rationalization defined by a client with hallucinations and delusions or example of disturbances. So here projection, rationalization defined by a client with hallucinations and delusions. These are the example of which disturbances. We will see here option A, reality testing, option B, thought process, option C, A and B, option D, none of the above. When individuals use these defense mechanisms, they are unable to test out their feelings or differentiate the real world from their personal intra-psychic perceptions. Reality testing here, projection, rationalization is defined by a client with hallucinations and delusions or example of disturbances. Reality testing. Reality testing, which means by an individual determine and assess his or her limitations in the face of biological, physical, social or environmental actualities. Projection, rationalization defined by client with hallucinations and delusions or example of disturbances of reality testing. So here option A is the correct answer. Next we will move on to question number 21. Respiratory center is stimulated by. Respiratory center is stimulated by. We will see here options. Option A, lactic acid, option B, blood pH, option C, oxygen, option D, carbon dioxide. The respiratory centers that are present in the brain are stimulated by the carbon dioxide contained in arterial blood. An increased concentration of carbon dioxide normally stimulates the body's respiration center in medulla oblongata. Here, medulla is the normally stimulated by an increased concentration of carbon dioxide. Increased concentration of carbon dioxide normally stimulates the body's respiratory center in the medulla. Respiratory center is stimulated by carbon dioxide. So here in these options, respiratory center is stimulated by carbon dioxide. Option D is the correct answer. Here next we will move on to question number 22. Graphian follicle of ovary secretes which hormone? Graphian follicles of ovary will secrete which hormone? We will see here options. Option A, progesterone, option B, LH, option C, estrogen, option D, none of the above. The Graphian follicle is the fully matured follicle which ruptures and releases the ovum during the ovulatory phase. After ovulation, the Graphian follicles transforms into the corpus luteum which secretes progesterone and it is required for the maintenance of pregnancy. Hormone secreted by Graphian follicle is estrogen. So here Graphian follicle of ovary secretes estrogen. Here option C is the correct answer. Next we will move on to question number 23. Who is father of psychology? Who is father of psychology? We will see here options. Option A, Sigmund Freud, option B, Wundt, option C, Sigmund Loyal, option D, Erikson. Wilhelm Maximilian Wundt in the year of 1830 to 1920 is known to posterity as the father of experimental psychology. He is first founder of the first psychological laboratory. Sigmund Freud was the founder of psychoanalysis. Don't confuse friends. Father of psychology was option B, Wundt. Full name of Wundt is Wilhelm Maximilian Wundt. He is father of psychology. Father of psychoanalysis is Sigmund Freud. William Wundt was German psychologist, philosopher and professor known today as one of the fathers of modern psychology. So here father of psychology means option B is the correct answer, Wundt. Next we will move on to question number 24. Immediate treatment of dog bite. What is the immediate treatment of dog bite? We will see here options. Option A, apply antiseptics. Option B, wash with soap and water. Option C, shift to hospital. Option D, tie the area. The immediate treatment of dog bite are the first aid for a dog bite. Very important to wash the wound as soon as bitten by dog, and the use of topical antibiotics such as Providone if it is available. If the bite is bleeding, put a pressure on it using sterile gauze or clean cloth. Then put antibiotic ointment on the area. Cover the area with sterile gauze or clean cloth. Seek immediate medical attention. Receive TT if not received last 5 years, and take anti-rabies injection 5 doses. The immediate treatment of dog bite or the first aid for the dog bite should be wash with soap and water. Option B is the correct answer here. Next we will move on to question number 25. Alopecia means. What is meant by alopecia? We will see here options. Option A, loss of skin. Option B, loss of teeth. Option C, loss of hair. Option D, none of the above. What is meant by alopecia? Alopecia is the medical term for bald, means bald hair. The word areata means patchy. The word areata, alopecia, is derived from the word areata. Areata means patchy. The partial or complete loss or absence of hair from areas of the body where it is normally grows. It is called as baldness. Alopecia is a areata. The causes for the alopecia is the immune system mistakenly attacks hair follicles, causing inflammation. Exact causes are unknown, but both genetic and environmental factors play an important role for the alopecia. Treatment for the alopecia. Traditional treatment for alopecia areata includes steroid injection to the areas where the hair has seen shed. Steroids suppress the immune cells that are attacking hair follicles, so hair will regrow. Alopecia is the term medical means bald. So here loss of hair is the correct answer. In these options, option C is the correct answer. Alopecia is a loss of hair. Alopecia means loss of hair. Next we will move on to question number 26. A newborn may be developing distress. What the nurse should have to observe? Here the newborn is having may be developing a distress. The nurse should have to observe which of the following symptoms. We will see here options. Option A, respiration. Option B, acrocyanosis. Option C, flaring nostrils. Option D, temperature. Here what is meant by distress? A breathing disorder in newborns caused by immature lungs. Neonatal respiratory distress syndrome, also one of the most common in premature babies. So here one of the most common premature symptoms is distress, means premature babies. In premature babies we can see the distress in most common syndrome. Usually develops within the first 24 hours after the birth. Signs and symptoms like fast breathing very soon after the birth, grunting sounds with each breath, changes in color of lips, fingers, toes, widening or flaring of the nostrils with each breath, chest retractions, clinical presentation of respiratory distress in the newborns includes apnea, cyanosis, grunting, inspiratory stridor, nasal flaring, poor feeding, tachycardia. A newborn may developing distress when the nurse have to observe flaring nostrils for each breath, flaring of the nostrils with each breath. So here option C is the correct answer. Next we will move on to question number 27. Which of the following variable is influenced by the intervention of the researcher? Which of the following variable is influenced by the intervention of the researcher? Here what is mean by variable? Variable, as the name implies, is something that varies. It is a quantity that may have several different values. These are broadly classified into two types. Those are independent and dependent. In a researcher study, the independent variable defines a principal focus of research interest. So here which of the following variable is influenced by the intervention of the researcher means dependent. It is something that depends on other factors. Dependent variable is a variable that is being measured or tested in an experiment. The dependent variable are the measured behaviors of participants, and dependent variable is the outcome of the manipulation. Here from the following variables is influenced by the intervention of the researcher is option C, dependent variable is the correct answer here. Next we will move on to question number 28. Fruity odor in urine is due to the presence of fruity odor in urine. This is due to which of the following? Options: option A sugar, option B ketone, option C uric acid, option D bile salt. High blood sugar is a telltale sign of both type and type 2 diabetes. If client has diabetes, may notice smell sweet or fruity odor in urine due to the presence of ketones. People with diabetes may have high level of ketones in their bloodstream. When the body excretes these in the urine smell like sweet or fruity odor. So here fruity odor in urine is due to the presence of ketone is in the urine. So here ketone is highly increased levels in ketone in the urine. Presence of ketone only fruity odor of urine is present. So here option B is the correct answer. Next we will move on to question number 29. Position used for tapping. Which position we can use for tapping? We will see here options. Option A lateral, option B prone, option C dorsal, option D Fowler's position. The preferred tapping point location are on either side of the horizontal line, but can be at any other position with 45 degrees on both sides of the horizontal line. So here the position is used for the tapping Fowler's position. Here preferred tapping point location either side of the horizontal line, but can be at any other position which can provide by 45 degrees and both sides of the horizontal lines. So here in these options, option D Fowler's position is the correct answer. Position used for tapping is Fowler's position. Next we will move on to question number 30. The 30th question is the last question in this part today's class. Next continuous questions we will discuss in further classes. 30th question we will discuss now. The technique used to open off oxygen cylinder. Which technique we can use to open the oxygen cylinder? We will see here options. Option A anti-clockwise, option B Upwards, option C. Clockwise, option D. All of the above. Use the cylinder wrench to turn the oxygen cylinder valve by at least 1/2 turn counterclockwise. Check the pressure gas to verify that there is enough oxygen in the tank. Medical oxygen cylinders are required to undergo hydrostatic pressure testing every 5 years. Here, the technique is used to open off oxygen cylinder is anti-clockwise. So here option A is the correct answer. All medical oxygen cylinders required to undergo hydrostatic pressure for testing every 5 years once. So here option A, anti-clockwise we can open the oxygen cylinder. This is the last question in this part today's class. From the 31 question number 31 to further question we will discuss in next class. Till now we discussed related to the model paper for staff nurse 2023 exam purpose. Thank you so much for watching my video. Keep watching, stay tuned friends. Anybody watching first time my channel, please subscribe my channel. Click on the bell icon for further notification and share your opinion in comment section. Please give a like and share the video to your friends. Related to the first model paper, I will give a link in description also. Just check it once friends. Stay tuned, keep watching. Thank you.